Welcome to Local Business Spotlight, everyone. I'm Troy Thompson. I'm over here at Life Care Centres of America, and I'm going to be speaking all about speech therapy with the actual speech therapist of Sean Lowe. Welcome to the show, my friend.
Thank you.
Nice to see you. Explain to everyone at home what a speech therapist is, if you wouldn't mind.
Sure. A speech pathologist or a speech therapist, we work with people in a variety of ways. In this setting, with Life Care Centers of America, we are considered medical speech pathologists.
Oh.
So we'll work with patients that need help with communication, whether it be with language or their actual speech muscles. We also do a lot of therapy for their swallowing, to help their swallowing be safe. We work with cognitive and executive functioning so that they're able to problem solve and increase their safety awareness.
Talk to me a little bit about what sort of training that you need to go through to become a speech pathologist.
Yes, sir. Well, we go through undergrad training, and then we have to go to a master's degree program. And then after you finish your master's degree, there's a 9-month to 12-month fellowship, clinical fellowship, where you work underneath a qualified, certified speech pathologist. And I was able to actually have the opportunity to go back and complete my doctorate training in speech language pathology. But you have to at least complete the master's degree and go through the fellowship.
What made you want to become a speech therapist to begin with? Because seriously, when you think about it, you think of other things. You don't think about speech therapy. At what point in your schooling did you go, this is for me?
Exactly. Well, it was before I started undergrad school. I actually helped out at a preschool and was working with some preschool children, and they actually were receiving speech pathology services at the preschool. And so that's what got me thinking about language and things like that. And then it wasn't until I got into graduate school that I start working with our adult and geriatric populations and realized that's a whole other area, a whole other population that really deserves speech pathology services.
Another question that just came to my mind, if someone is of international accent, okay, and they're needing speech pathology, but maybe you don't speak Italian, okay, but they've got broken English, how do you know you're making a difference for them?
You certainly have to do some education for yourself to see, what sort of dialect they're using, what type of, get a foundation of their language. But a lot of the skills and treatments that we can do will work across all languages and across, different accents and dialects.
I want to ask you, what sort of conditions, illnesses as such, would someone have been inflicted by that would need a speech therapist? I'm thinking heart attack, maybe stroke, brain hemorrhages, things along those lines?
Yeah, especially in this setting with medical speech pathology.
Okay.
We work with a lot of people that have experienced strokes, and that certainly can affect they know what they want to say, but they can't get the words out, or they may have trouble understanding the words that are spoken to them, or a mixture of both. And then depending on where the stroke occurs, that can affect their swallowing.
Yes.
We work with folks that might have Parkinson's disease, and that affects their vocal intensity, their ability to communicate. We might work with just people that have been through a surgery and just have general debility that are recovering from their hospital stay, and they might require our services.
Why does your speech pathology here at Life Care Centres of America outweigh most other places? Why are you guys the leaders in it?
Well, what I love about this building, and I've had the opportunity to work at a couple other different buildings of Life Care here in the Chattanooga area, and we have a very integrative approach. There's a lot of collaboration with our physical therapists and our occupational therapists. I may work with an individual that is high functioning and had a stroke and is hoping to return back home and be independent. And I may work with the physical therapist to make sure that they're following their safety recommendations, they're transferring and managing their medications, all those things that are appropriate. And we may work with folks that are even a little bit lower on the developmental scale.
I think that's amazing. Thank you so much, Sean.
Thank you.
If you want to find out more information, there it is up on the screen for you. Life Care Centres of America.